Hello and welcome to Expert Panel with Zuhair Hussain. Melburnians are bracing up for stage 4 restrictions as this pandemic has turned out to be a lot harder than what we originally thought it would be. And there are multiple reasons to that. COVID-19 has influenced significantly to our lives, the way we live, and it has changed how we would live from now on. It is a global pandemic and countries around the world are battling to combat this pandemic. Australia's response to this pandemic has been significant, and it has been of great effectiveness if you compare it with Europe and America especially. The government has done some significant work, taken some serious measures to calm it down, to flatten the curve, but as expected, it has its challenges that we all are trying to get through with some aspects of this situation proving to be a little difficult, and that's why we have these new sets of restrictions, this curfew and all the rest of it that you all have been hearing in the news. Today, to discuss about the current situation, I'm honoured to have Bronwyn Halfpenny, who is the Member of Parliament for Thomastown District. She will join us in a second and we will talk to her about government policies on how to effectively manage COVID, what the plans are, and how we as a community can contribute towards this overall epidemic that we all are going through. So without any further ado, I'll bring in my special guest today. Bronwyn, welcome to Expert Panel. How are you?
Hi, I'm good, thanks, Zuhair. I'm very good and, well, as good as you can be in this terrible time, but yes.
Correct. Thank you for taking some time out to come and talk to us from PWOA's Facebook page.
I'm really pleased to be here, and I guess just before we sort of start, I'd really like to thank the Australian Pakistani community for doing so much voluntary work during this time. I know there's been a lot of help for the elderly and those that have been isolated at home with providing shopping and necessities and many other things, of course. So I just wanted to thank everybody, I guess on behalf of the whole of the Victorian community, for all the work that people have done.
Thank you, and appreciate the acknowledgement. We'll move straight on to the subject, Bronwyn. Stage 3 has left us behind, and now we have entered stage 4. Can you talk us through on how you, as government, as representative of the government, think that is going to drive the numbers down, and what are the core objectives from this stage 4?
Okay, well, thanks, Zuhair. I think it's pretty obvious that the numbers we haven't had thousands each day of positive cases of COVID-19. They have not been going down as fast as the government would like. And in fact, if we kept on this course with the stage 3 restrictions, it was, I think the medical advice was that it would take a very, very long time to suppress the virus. So the decision was made to increase the restrictions to try to control the community transmission. So that's the passing on of the virus from unknown sources, because you can control the virus, which is wildly contagious, if you know and can track where it's coming from. But of course, as soon as we can't do that and we don't know where the virus is being caught from, because a lot of people don't have any symptoms, the view was that there needed to be stronger restrictions to try to prevent the movement of people and therefore the movement of the virus to more people. And that's why we have, unfortunately, stage 4 restrictions. And the hope is that by doing it this way, we will control the virus earlier.
Do you think that the stage 3 restrictions, they didn't work, or it was just a matter of people not listening and not complying?
Probably a little bit of both. I think the view was that the stage 3 restrictions were not quite enough to really bring the virus under control as quickly as possible. I think there was the advice was, as I understand it, because of course I'm not an expert, but from what I understand, what we're told as government members, that while it was having an effect, it just wasn't doing it quick enough. And of course, we're all worried about businesses. We're worried about the mental health of those, stuck at home, our young children. So the idea was, and the view was, that let's hit it a bit harder and hope that this will reduce the virus to spread much quicker, so that we can start going back to a sort of a normal life much more quickly than we could under the stage 3 restrictions.
What are your comments on people's attitude? How do you think Victorians have been in this stage 3, which has just gone past? Are you happy with Victorians overall?
Well, I think it's probably 98% of Victorians have done the right thing. They've followed the rules. They've done what they need to do. And in doing that, they've also been very kind and caring to others. But there is a small percentage that haven't done the right things. They haven't followed the rules. For whatever reason, maybe they don't think it's serious. Maybe they don't care. But this is something, and we look at it now, instead of having 1, 2 people dying each day, we're having 13, 15 people dying just of this virus, and these are preventable deaths. So all those people not doing the right thing, they really, really, really need to think seriously, because if they continue to do this, we're going to have more economic suffering, more personal suffering, and we can't overcome this virus.
Right. The new heftier fine that's brought in just with this stage 4 restriction, which is probably in excess of $4,500. Why do you think this wasn't exercised in stage 3? Why in stage 4? Like, if they had tried to deploy this at an earlier stage, maybe that would have helped.
Look, I think you have to look. We sort of like to think that people do the right thing, and it's not until and I think that was assumed that that people would do the right thing and that there would be a fine if people didn't. But now it's become more serious. It does take time as well to increase fines. So, for example, we were under a state of emergency before, under stage 3 restrictions. We've now had that upgraded to a state of disaster. Because we are now in a disaster, that allows for the higher fines and it allows for more police powers. Because as a government, you're also controlled by what the laws are at the time. So sometimes you can't just increase fines unless you change laws or change regulations. So it's not always something that can happen really quickly. And I think at the start, the $1,600 fines were enough to sort of give people a fright and to do the right thing. But now it's so much more serious. There are so many more infections, hence the increase in the fines to match that more seriousness.
Right. The point I feel where historically, if you look at the numbers, when the hotel quarantine first started, just security guards, like public crowd control guards, were deployed to make sure that no movement of those people is happening who are being quarantined. Do you think that was a turning point where it started to pick up the pace, where the numbers started to go up? Was that a wise decision? Because it was soon replaced with the security that we have at the jails.
So I think there is an inquiry on that. So we've sort of been asked not to speculate about what is going on, because there is a judge appointed, or a former judge, who's conducting the inquiry into this. And I think once that inquiry is over, which is they're due to report in September, action will be taken based on what the findings are of that inquiry. But can I just say that security guards were also used in other states, and there wasn't, that the virus hasn't spread like it has in Victoria at this point in time. And there was security guards also employed in hotel quarantine in the other states as well. But I think let's leave it to the judge to get all the evidence. We all hear the media. We can all sort of have our ideas, but we don't really know exactly the full story. So I'm sort of, I guess, maybe I can answer that question after we get the findings of the inquiry in September.
Right. Premier Daniel Andrews, today he was talking about those mystery cases, 760 of them probably, that they're not able to trace. What's the reasons there? Are the case numbers too high, or do we not have enough resources to go and be able to trace those cases?
Well, the cases he was talking about were actually ones that they could not find the source. So it wasn't necessarily about the contact tracing. It was actually about not being able to find the source of the virus. And that is why there is the concern about the community transmission, because, as he said, if there is that many that they can't find the source of, then it's also expected that there's a whole lot more people in society that have the virus, may not know because they don't have any symptoms, but they have this virus and they're spreading it to others. So right. I think the community transmission is more about the insidious and awful nature of this virus, and that is that many people don't have symptoms, they don't know they have it, and they're mixing with other people, and then it's so contagious, it's being passed on to others, even though the person doesn't know they have it.
Right. Now, we've seen that door knocks have started in recent weeks, and we have started to see that the Department of Health, they are uploading information from their Facebook page in specific languages to particularly address those people who might not be getting the message. If we take that for a second, do you think that the way we have been dealing with this situation, where the Premier and the Chief Health Officer would conduct a briefing, a press conference every morning and tell people what to do, has that been effective? Do you think a press conference is enough to get the message through to the wider community effectively? Has that worked, or has that, what are your comments on that?
Look, I think the press conference is not the only thing to get the message across. The press conference, I think, is more about, this is what our society would expect, that the Premier fronts up to the media and is asked questions and scrutinised and checked, why are you doing this? Why is that happening? So I would see the press conference itself not just about raising awareness or educating Victorians, but it's also about him every day fronting up with the Chief Health Officer to be asked questions and to be scrutinised. So he's, transparent and being open, and any journalist has the right to ask any question of both the Chief Health Officer and the Premier. So then when you look at other forms of communication, I think there is a lot of talk about, is it enough? Is it getting the message across? And while I guess people are going to work and they're sick, obviously the message is not getting across if that's still happening.
Because the numbers haven't declined, and it's, we have seen it otherwise. So the efforts to reach out to the wider community, what efforts government is taking now, or what is the plan now to reach out to wider communities where, language barrier may be an issue?
Okay, so I know and look, maybe it's, and I said this to Saeed, we could probably get, I'm happy to try to organise, say, the Minister for Multiculturalism to come and be interviewed to talk about the things that they're doing, as well as the Premier's office or whatever. But there is a whole lot more information being provided in different languages. There's also if people want to ring the hotline for the coronavirus to ask questions about what they can't do, what they should do if they feel sick, there's also a 1300 number that you can ring and ask for an interpreter, and that they will then provide information in the language that the person has requested. So there is those things around. I think one of the problems for us, and I guess I'll put it to ask for everybody, all of your help. We don't know of all the WhatsApp groups, all the Facebook and social media outlets that people are using. So because of that, we can't actually get a lot of information out in a way that that people from various different communities may see. So that's something that we probably need to get better at. I know that we're trying, and there's a lot of material, but whether that material is then getting to the right places and the right people, that's, I think, the problem.
Because I feel that there isn't enough community leaders engaged with the government in order to work with the government to deliver the message out to the wider communities, because awareness and knowing how the virus moves is to stop the spread. So are there any planned activities or any any communication that's planned to be spread amongst the local community leaders?
Okay, well, I know that I've been involved in a Zoom meeting with many members of both the Lebanese, or community leaders in the Lebanese community, as well as media outlets. I know that the chair of the Multicultural Commission was there. There was a representative from the health department. So those things are all possible, and maybe I think we would love if we could do that with yourself, Saeed, and other community leaders. I think that would be really, really helpful, and we would really appreciate it if it can be organised.
Right. Is there any what sort of role the councils are playing in terms of reaching out to people, let's say in your constituency?
Well, I do know, I have spoken to the Whittlesea Council, and my understanding is they have various contacts and groups, in particular sort of the more vulnerable groups, elderly, people that have some disabilities, that have trouble maybe getting out of their home to do the shopping or whatever. So they do have a lot of social services and supports. They're doing a lot of phone calls. They're providing a lot of facilities. The state government has provided money to councils to ensure that they get the essential things that people need to them. And I understand that the Whittlesea Council, in that regard, is doing a really good job. They are getting to people. There's always someone that may be missed, but my understanding is all the people that they are aware of, they have been providing a lot of support to.
Right. On our platform, Bronwyn, as part of Pakistani community, we have a lot of migrants, and we have a large number of students.
Yes.
In Melbourne, as you would know, students have been a critical part to Australian economy, where they come in and they pay big fees and do the right thing, pay the taxes, work hard. Do you think that government has done enough for the students? Or do you think it has been a case where they have been given a bit of a cold shoulder just because they're not citizens or they're not permanent residence holders?
So the international students contribute a lot. Most work, they pay taxes, they do all the things that everybody else does. And in many cases, international students couldn't go back to the country they came from because the borders were closed and there was no flights. So, I know the state government provided a small one-off payment of support. And obviously that means, because we believe that international students should receive support, because anyone that's in Victoria or in Australia at the moment during a pandemic should have the full support of the government to ensure that they have a roof over their head, they have food, and they have, you know, the necessities of life. I guess from a state government, which is the Victorian Government, and I don't mean this as a, you know, punt it off to somebody else, but we don't collect the income tax, and we don't provide the income support like Centrelink, Social Security. That's a federal government responsibility, not just a responsibility, we don't have the power to do that. So yes, I think that international students and all people on temporary visas, whether they're temporary working visas or student visas, if they're in wherever they are in a place that's suffering a devastating pandemic that none of us have sort of ever seen before, and it's a global pandemic, should have been supported.
If let's say a community member that's listening to this conversation will listen to this conversation afterwards, is there a government body, is there a Victorian state level body who people can reach out to if they are in some devastating situation because of the pandemic and they don't have the citizenship or the permanent residence to get the federal government claims or payments?
Okay, so the state government did provide the one-off payment of the $1,500, but if there's you know, if it's about, you know, for example, somebody's had a test and they're at home and they're waiting for that test result, then the state government is providing $300 for people while they're waiting for the test. If a person is positive for the coronavirus, then the state government is providing a payment in lieu of sick leave so that people can stay home without having to worry, do I feed my family or do I, you know, and work, or do I do the right thing and stay home? So that's why those financial payments are being offered. But if we're talking about just in terms of being destitute because, you know, they were working in hospitality, that's all closed down, there's no more income, then, well, to be honest, that they can call me and I can try. It depends on what area people live. It depends on what sort of things there are available. So there is food bank. All the councils do provide emergency relief, whether it's funding or food and groceries. So there are a number of places that people can go, but it depends where they live as to where it is. But probably the council or their local member could help in the first instance, as well as the website if you go onto international students, if you want to seek some sort of financial support.
Right. So that $300 you mentioned earlier on, is that for everybody who gets tested? That $300 once-off payment, is that for everybody regardless of their citizenship or permanent residency status? Is that correct?
So the $300 is if you've got symptoms and you have a test and you're waiting for the test result, then that's $300 while you wait for the test. So if you're negative, then there is no other payment. But if you're positive and have to self-isolate, then there is the payment in lieu of sick leave, and that applies to anybody that has a COVID positive result.
Right.
And that is to just so that people do not go to work and stay home and keep all of us safe. Right.
In terms of the message out to the community, we would run this as a case where we would open lines and leave a message on our Facebook page as a post for people to reach out to us if any part of this conversation they need help understanding with. But what's your expectation from let's say the government's point of view on how people can adhere effectively in terms of complying with the restrictions and what measures on individual level people should take?
Well, I think the first thing is to stay at home, except for the 4 reasons, which is so the only time you're leaving home is if you need medical treatment, if you need to care for somebody, provide groceries to somebody else, whether you have to work or conduct training, or if you need to, so they're the 4. Now, and to wear a mask. So with the new restrictions, the reasons for leaving the home are even smaller. So, for example, shopping, only one person must go shopping once per day, no more than that. So you can't go with 5 different people, even if they're all from the same family. Only one person can go shopping now, and this is all about trying to minimise the contact with other people, so therefore it minimises contracting the virus yourself and also passing the virus on to others. So I think as individuals, wearing a mask, staying at home, and if we do have to go out, making sure we do the social distancing so we're not close. I mean, it's very easy. I can see myself sometimes. I see somebody I haven't seen for a long time in the street, and you almost go to shake their hand or give them a hug, but no, don't do it. We really have to make sure that we change our behaviour and make sure that we do the social distancing, make sure we wear the mask, and make sure we stay home as much as we can.
There is a global race in terms of coming up with the vaccine. Where do you think Australia is, and what efforts are being done towards the vaccine here in the country?
Well, I know that and I can't remember the amount, but I know that the state government, even in Victoria, has put in a lot of money to support research on or the COVID-19 vaccine, and similarly the federal government. I know, of course, that Victoria has been contributing that at the Doherty Institute, but also I think there's trials of various things in Queensland and other parts of the country. We hear talk about this, there's going to be a vaccine, but we keep hearing that and it still hasn't quite happened. So I think we all hope that there will be one. I don't think anybody's saying that the money's not there for the research. It's more about the ability to actually create a vaccine for a virus that changes all the time.
Are we working with any international partnerships on coming up with the vaccine on government level?
Sorry, I think I froze for a second.
Yeah, you did. I was saying, are there any partnership with other countries on international government level in order to come up with the vaccine?
Look, I'm sorry. I can get back to you on that. I do know there is, and I just can't remember. I'm sorry. I can't remember. Yes, but there has been partnerships. Yes. Yep.
There have been. Okay. In terms of travel ban, a lot of people that are here in the country on visitor visas, etc. When can they expect the borders to open so they can fly back to where they came from?
So, what did you ask? When can people fly back to? Sorry, what? Yeah. I missed that again.
Okay, yeah, I'll repeat my question. There are a lot of people that are here on visas. So when can they expect the borders to open so they can fly back to their countries?
On that, can I just say I feel so sad for people that have, basically been, separated from family, from friends, from wives, parents. Because we were so used to a global world where you could just so easily move from one place to another. There was not even any thought that you couldn't see a loved one if you wanted to. And then we've had this pandemic, which, yes, I feel very sad to think of the many people that haven't been able to go, travel freely to see loved ones and, people that are sick and all that sort of stuff. I think that, again, the federal government is the one that will determine this, but it doesn't look like it's going to happen, anytime soon. I think even the prospect of New Zealand and having a travel bubble where people could go from New Zealand to Australia. I think the Prime Minister of New Zealand just recently has said that's not going to happen for quite some time. So I think it's really hard until we know after this 6 weeks of the restrictions in Victoria, what's going on in New South Wales, because that's always looking a bit of a worry too. I think we will know more in 6 weeks' time once we see how these restrictions work and if it has really suppressed the virus transmission.
Right. How do you think our response to this pandemic has been in comparison to New South Wales? The case numbers significant. They vary significantly in terms of them getting onto it, and in terms of us. Have people been? What do you think? Like, in your opinion, have people been more compliant in New South Wales, or what has been the case?
I actually read something that said that Victorians were, in the first lockdown, were the most compliant than any other state. And now don't quote me on that, but that's what I vaguely remember reading. And I think most people have been really good. I don't know if we could compare people in New South Wales versus Victoria as to who is better or worse. And I wouldn't want to get into that competition, and I think, we need to look back. Originally, when this first happened, there was that Ruby Princess, the cruise ship, where everybody was allowed off to mingle around and not have testing. And, we all sort of said, oh, New South Wales, why did they do that? Terrible, terrible. I think when you look back now, in hindsight, you could say you shouldn't have done this, you shouldn't have done that, but this is something so new. I mean, I think everyone's trying to do the best they can. No one has bad intentions, but it's something that people are learning as they go along. So, what's happening in Victoria now could have easily happened in New South Wales or Queensland, but, it just almost seems like, I don't know whether, yes, I don't know. Sorry, that was long-winded.
Right. People who have to go into mandatory quarantine, what's the clear or last policy that's there on that? Do they do that on their own expense, or is it done on government expense in the hotels? What's the news on that?
So my understanding, because remember in Victoria all planes are being diverted away from Victoria, so there's no quarantine or new travellers coming into quarantine in Victoria. So my understanding is in the other states there is a payment. It's $3,000 per person, but each state makes their own decision on this. So Victoria, because we don't have any new travellers coming in at the moment, nobody is paying for their quarantine. Right.
Okay, beautiful. Thank you very much for all the insights, Bronwyn, and all your and answering all our questions. We just have got a question on screen. When can Australians travel overseas again? I think we've just addressed that we don't know. It's wait and see. Time will tell. Sort of a thing.
There is the possibility. I know of my office. We have had some approaches about people that travelling either for work or compassionate reasons, having to go overseas, and so we have tried to help. So there is exemptions. There is the ability to have exemptions, but you have to have a very good reason, and of course, there's no guarantee that you're going to get back. That's you'd have to expect that you're going to stay wherever you're going for a very long time.
Thank you very much, Bronwyn. It was a pleasure to have you here with us. Talk to us live. We have had a lot of viewership all throughout the stream. Thanks for answering all the questions. And again, like you've said, the common sense rule applies on people who comply and do the right thing, and aim and hope that we'd be over and done with, hopefully, in 2020. Otherwise, a Christmas in a lockdown would be worse.
Yes, that's right. Let's hope it's we've got it under control by then. And I think I just want to thank everybody that is doing the right thing. And really, if you see somebody that's not maybe ask them, hey, do the right thing, because the more we do the right thing, the quicker it's over, and the quicker we can all get back to our at least semi-normal life.
Right. Beautiful. Thank you very much. I hope you have a good night, and
Thank
we'll
you,
catch
Zuhair.
you sometime again.
Okay, I hope everybody has a good night, including you, and look forward to speaking to you again. Thank you.
Thanks, Bronwyn. Good on you. Thanks. Ladies and gentlemen, that was Bronwyn Halfpenny, Member of Parliament for Thomastown District, answering our questions and giving us the insight on how the government plans and intends to tackle this COVID-19 pandemic. And the message is clear. We all should be driven by common sense, comply with the restrictions, do the right thing. We're all in it together. If everybody does the right thing, it all gonna help all of us together to get back to our normal lives sooner than later. Take care, everybody. Stay home, stay safe. We will catch up with you again next Tuesday with some other subject and another guest. Until then, thank you.